Hi, you guys. Welcome back for our daily practice questions. It is day 13, but as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number 1 for today. Question number 1 states, a 40-year-old woman presents to your clinic complaining of itching and pain in her right ear for the past 3 days. She mentions that she recently returned from a vacation where she spent a lot of time swimming. On physical exam, you observe tenderness when palpating the tragus, and there is redness and swelling of the external auditory canal. Upon otoscopic exam, you see a swollen erythematous ear canal with some discharge, but the tympanic membrane is intact and normal. What is the most likely diagnosis? Is it A, acute otitis externa, B, acute otitis media, C, inner tube dysfunction, or D, tympanic membrane perforation? Take a moment and tell me what you got in the comments, you guys. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to assure that you're answering what is truly being asked of you, right? So here the stem of the question states, what is the most likely diagnosis? And y'all know I tell you, if they're looking for a diagnosis, you need to run it back and look at the assessment findings. Look at the signs and symptoms. Look how they're presenting. Look at the chief complaint. Look at what is noted on exam. But also, when identifying these things, pay attention to these three components if they are provided: the age, the gender, and the ethnicity, because this can help contribute to determining a diagnosis and treatment, right? So here we have a 40-year-old female that came into your clinic complaining of itching pain to the right ear for the past few days, right? She mentioned she just came back from vacation, did a lot of swimming, and on physical exam, there's tenderness noted to the tragus, and there's redness and swelling to that external auditory canal. On exam, you also note some swelling and erythematous ear canal with some discharge, but the tympanic membrane is intact. Now, I know I just said a mouthful, but let's break this thing down and always pay attention to those key identifiers, right? So one of the key identifiers is the tenderness of the tragus. Now, when we're talking about ear issues, remember, with acute otitis externa, tragal pain is the most common complaint, right? And if you think about it, it's because the tragus is a port of the external portion of the ear, right? And if we think about what's going on here, typically a bacterial source has caused inflammation and irritation to the outer portion of the ear. So this is already leading us here, right? Tympanic membrane is intact. There is noted itching, which is classic also with acute otitis externa. The patient was on vacation, did a lot of swimming. Acute otitis externa is also known as swimmer's ear, right? Why? Because there can be bacteria in the water that they're swimming in, and as that water gets into the ear and sits, it can lead to acute otitis externa. So in this scenario, the best answer is A. All right, question number 2. A 55-year-old male with a history of diabetes presents to your clinic with complaints of severe pain, itching, and drainage from his right ear for the past 5 days. Upon examination, the external auditory canal is swollen, erythematous, and has purulent discharge. You diagnose otitis externa. What is the most appropriate first-line treatment for this patient? Is it A, cipro and dexamethasone eardrops, B, oral amoxicillin, C, topical hydrocortisone cream, or D, oral azithromycin? Take a moment and tell me what you got in the comments, you guys. All right, so stem of the question here states, what is the most appropriate first-line treatment for this patient? So y'all know, I always tell y'all, if we're looking for the treatment, you need to first look and see if they provided you with the diagnosis. If they have, cool, and then we'll figure out treatment options, right? But in the event that the diagnosis has not been provided, you got to run it all the way back to the top, right? We got to look at those assessment findings so that you can determine what the diagnosis is, because you got to know what it is to know how to treat it, right? So here, the diagnosis has been provided. The patient has been diagnosed with otitis externa. So now, not only do we need to determine what is the treatment, but it states what is the first line treatment option, right? What's the most appropriate first line? And in this scenario, A is your best answer, the Cipro and dexamethasone eardrops. Because, all right, with otitis externa, we have a few first line therapy options. We have our Cipro, we have our neomycin combo with the polymyxin B, and that's typically utilized in more milder cases. We have our ofloxacin. So we have a variety of things, but there are levels to it, right? So in this scenario, and more commonly, that Cipro and dexamethasone combination is typically the top of the first line, okay? And then in this scenario, A is your best answer. And then lastly, question number 3, a 48-year-old woman presents with a 3-day history of itching, pain, and drainage from her left ear. She reports a history of recurrent ear infections and mentioned that she previously had a perforated tympanic membrane that healed on its own. Upon exam, the external auditory canal is swollen and there is purulent drainage, but the tympanic membrane is difficult to visualize. What is the most appropriate treatment for this patient given her history of tympanic membrane perforation? Is it A, the combination of neomycin, polymyxin B, and hydrocortisone eardrops? Lord, that's tearing me up. B, ofloxacin eardrops. C, oral amoxicillin. Or D, acetaminophen. Y'all, I'm starting over. Is it B, your neomycin and combo with the polymyxin B and hydrocortisone eardrops? Is it B, ofloxacin eardrops? Is it C, oral amoxicillin? Or is it D, acetaminophen for pain management? Okay, what y'all think, y'all? All right, y'all. So, stem of the question here is, what is the most appropriate treatment for this patient given her history of tympanic membrane perforation? All right, so listen. Again, we're going to go through the steps because of the treatment, right? We need to look and see what we're treating, right? So this lady has come in. She has a 3-day history of itching, pain, and drainage from her left ear. She reports a history of recurrent ear infections, and she just recently had a perforated tympanic membrane, but it healed on its own. Um, on exam, the external auditory canal is swollen and there's purulent drainage, but the tympanic membrane is difficult to visualize. All right, so listen, this is still your classic presentation of your acute otitis externa, right? But in this situation, she has a history of tympanic membrane perforation. It healed. She states that it healed on its own, but the tympanic membrane is still difficult to visualize. So you need to consider all these things when you're thinking about treatment. So B is your best answer. And I'm going to tell you why. Remember, I was telling you the ciprofloxacin and dexamethasone combo is one of your first line. The neomycin, polymyxin B, hydrocortisone combo is in that first line. Ofloxacin is part of those first line agents that are good. But with that Cipro combination and the ofloxacin, they have low sensitivity rates, whereas the neomycin combo is known for ototoxicity. So she already has a history of perforated tympanic membrane. So we definitely don't want to use something that already has a potential risk factor of ototoxicity, right? So your best choice to go with is B, ofloxacin eardrops, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio1@gmail.com. All of the things that I do offer are linked in the bio of this channel, including my website. And if you're looking to book any of my one-on-one sessions, personalized tutoring for students currently enrolled still, as well as my custom packages and plans, I always say either call, text, or email so that I can gauge what you truly need to make sure you're booking the appropriate session type, okay? All right, you guys, y'all know what to do. Make sure y'all meet me back here. Happy studying. Bye, y'all.